Hey, what's up, guys? It's me, ThePsychNPDavidC. As a psychiatric nurse practitioner, I get asked a lot of the same questions from my patients. And to be fair, they're valid, great questions. So today, I'm going to break down the top 5 questions I get from my patients, along with what I say in response to those questions. Whether you're brand new to psych treatment or you've been getting treated for years, understanding what to expect can make treatment less scary and more collaborative. Let's talk about it. Now, these questions are in no particular order, but starting with number 1, a question I get a lot is, how long will it take for my medication to start working? So the answer I give is pretty dependent on which medication they're talking about, because different medications have different onset times. The medications I prescribe the most are SSRIs, which are a class of antidepressants. For SSRIs and just other antidepressants in general, it'll take about 4 to 6 weeks to get the full therapeutic effect. And this is 4 to 6 weeks at an optimized dose. Like, yeah, you will see some mild improvements in like sleep or appetite within the first couple weeks, but to get the full effect of the antidepressant, it takes about 4 to 6 weeks. And then regarding stimulants like Adderall or Ritalin, the effect is pretty quick. You should feel it within like an hour. Like, let's just pretend you're gonna take Adderall to help you study. You should start feeling more focused within an hour after taking it. And then for less commonly prescribed medications like mood stabilizers or antipsychotics, they usually take around 1 to 3 weeks, depending on the dose and indication. There's a very common misconception among a lot of people that they expect a flip in their mood like a day after they start taking their first dose, when that's actually not how it works. So whenever I start my patients on an antidepressant, I always tell them up front, you shouldn't expect any mood changes until you take it for at least 4 to 6 weeks. If you say you feel an improvement in your mood in like 1 to 2 weeks, it's most likely placebo effect. So antidepressants are more like a gradual increase in mood. It's not just like an immediate switch. If anything, within the first 1 or 2 weeks, all you're gonna feel is side effects. For most antidepressants, side effects usually show up before the benefits. So it's very important to know that, so you don't just like give up on the medication only 2 weeks in. So, you know, whenever I see a patient for like the second time after they started an antidepressant 2 weeks ago, and they're like, I don't feel anything, I'm just nauseous, I don't wanna take this anymore. I'm like, remember what I told you during the first appointment? It's gonna take 4 to 6 weeks, without that sarcasm, of course. So yeah, generally most medications take a couple weeks to build up in your system. And question number 2, will I have to take this medication forever? Now that's a very valid question. Nobody wants to be like dependent on medications forever. There's medications that are used for like short-term purposes, and then there's meds for long-term purposes. So medications for short-term purposes are usually quick-acting anti-anxiety meds like Ativan or Visceral. So you shouldn't be taking these routinely, only when you feel like an anxiety attack coming on. You shouldn't be taking these kinds of medications forever because they're only supposed to be taken as needed. And then there's long-term medications that should be taken every day, like antidepressants. They take weeks to build up in your system, and then you have to keep taking them to maintain steady blood levels. So for these kinds of medications, there is a chance that you might relapse if you stop taking them. In general, if you're in like your first depressive episode, if you're in remission, which means you have like no symptoms anymore, for at least 6 to 12 months, then it would be safe to start slowly tapering you off that antidepressant. A lot of providers lean towards the 12-month mark just to reduce the risk of relapse. Now, if you're in a recurrent episode, which means it's your second episode or more, you should be in remission for about 1 to 2 years before considering tapering off. And again, many providers prefer the 2-year mark just to reduce the risk of relapse. Now, there are special cases where if you're like bipolar and you've had 2 or more mood episodes, many guidelines recommend being on a mood stabilizer indefinitely. So yes, there are a few situations here and there where we recommend that you be on medications forever, but for the most part, if you're in remission for like 1 to 2 years, it's probably safe to slowly taper you off. And then question number 3, what happens if I miss a dose of my medication? This one happens pretty commonly, but I mean, we're all humans, so we're gonna forget sometimes. So again, this really depends on the medication type that we're talking about. If it's an antidepressant, missing 1 day of a dose doesn't really affect you that much. But if you miss a few doses in a row, it can cause some withdrawal symptoms like brain zaps, dizziness, or even like irritability. If we're talking about stimulants, missing a day just means you're going to be like less focused for that day. It usually doesn't cause any withdrawal symptoms. And for mood stabilizers, missing a dose can actually destabilize mood by quite a lot. So I do emphasize a lot more to my patients who are on mood stabilizers to remember to take their meds every day. Consistency is key because most most medications take a while to build up in your blood. So if you miss doses repeatedly, it's gonna mess up the levels that are in your blood. Some tips for remembering to take your meds are like either setting up a phone alarm or just using a pill organizer. I actually think pill organizers are pretty underrated because let's just pretend it's like Monday and you don't remember if you took your meds this morning. You can just look at the Monday section on your pill organizer and see if there's still pills in there. So yeah, you don't have to be taking like 50 meds to be using a pill organizer. In general, if you realize that you missed taking your medications within a couple hours, you should probably just take it. But if it's like almost close to the timing of your next dose, you should probably just skip it. Don't double up. I always tell my patients like, yeah, missing one dose here and there isn't really a big deal, but if it becomes like a repeated pattern, it can definitely mess with your progress. And then question number 4, how do I know if my medication is working? I get this question a lot regarding like long-term medications that need to build up in your system first. So before we begin treatment, I always tell my patients to track their symptoms. Like how many hours of sleep are you getting right now on average? How's your appetite? How's your energy levels? How's your motivation? How's your ability to focus? It's really helpful to kind of like label these on a 1 through 10 scale. So let's say your anxiety level at first is like 8 out of 10, and then 4 weeks later, you might be like at a 5 out of 10. So that's how you know it's working. And another thing that's actually pretty useful is if other people around you have noticed a change in their mood. And like I've had patients tell me that their friends have told them like, you seem calmer or you've been laughing more. That's a pretty good way of telling if your medication is working too. Because your friends and family, the people who spend the most time around you, they're definitely going to notice mood changes if you have any. And then on to question 5, what if the medication doesn't work? So this happens a lot more often than people think, and it's okay. It's a normal part of the process. A lot of psych medications are honestly just trial and error. Like, yeah, we'll pick the medication that we think is best for you, depending on what you're saying about your symptoms and other things like your age and other medical conditions. But medications work differently for everyone. Like, let's just say your friend says they take Zoloft for depression and they say it works wonderfully for them. That doesn't mean Zoloft is going to work wonderfully for you. Okay, so what are the options if a medication isn't working? First things first, we try to adjust the dose. Like maybe you're just not on a high enough dose. I had a patient say they were like getting worse on Zoloft at 50 milligrams, but then when I upped it to 200 milligrams slowly, they said they're like happy again. And then if you're at the max dose and it still isn't working, we could try switching to another medication within the same class. Like for example, switching from Zoloft to Lexapro. Another option is to add on other medications. Like if somebody is maxed out on Zoloft and they're still feeling depressed, you could add something like Wellbutrin to help with that depression. The goal is to have as few medications as possible, but sometimes adding on another medication can actually be pretty beneficial. And then you could also try adding on psychotherapy or making lifestyle interventions. Like if somebody's taking meds and they're still complaining of depression, but they're not attending therapy or like they're not exercising, it's probably better to consider those first before you make any medication adjustments. So to clear things up, just because one medication doesn't work for you doesn't mean you're like treatment resistant. It just means we probably haven't found the right medication for you yet. So now let's just quickly recap the top 5 questions I get from my patients. Number 1, how long will it take for my medication to start working? About 4 to 6 weeks in general. Number 2, will I have to take this medication forever? No, if you're in remission for like 1 to 2 years, you can probably start slowly tapering off. Number 3, what happens if I miss a dose? Most likely not much, but try to be as consistent as you can. Number 4, how do I know if a medication is working? Track your symptoms over time and see if your friends or family say anything that they've noticed. And number 5, what if the medication doesn't work? Adjust the dose, switch medications, add medications, or just doing psychotherapy or lifestyle changes. So yeah, being on psych meds can be a little scary, especially when you don't know this information. But the more informed you are, the more you'll know what to expect. And don't expect to remember everything, just ask your provider if you have questions. That's how good treatment happens. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. And with that, your mental health just leveled up. You're welcome.